Thank you, Derek. Thank you so much, especially for keeping this meeting safe. That was a little interesting last month. So February, people's thoughts turn to love and romance with Valentine's Day, but it's also the perfect time to turn your focus on the human heart, recognizing cardiovascular issues and learning how to take care of your heart. So given the fact that cardiovascular disease is the #1 cause of death among men and women, we wanted to focus our program on key concerns for seniors related to their heart and health. So joining us today is Dr. Suman Manchireddy, a board-certified internal medicine specialist at Reliant MD Group in Leesburg. With over a decade of experience in preventive care and chronic care management, Dr. Manchireddy specializes in treating chronic illnesses like diabetes, heart failure, asthma, COPD, and hypertension. He also offers medical weight loss services to improve patients' health and well-being. So please join me in welcoming Dr. Suman Manchireddy.
Yeah.
Yeah, can you hear us? Okay.
Yes. Can you hear me?
Yes, thank you so much for joining us this morning.
Yeah, no problem. It's a pleasure. Nice to see you all. It's a great pleasure talking in front of you guys. I'm Suman Manchireddy. I'm one of the internists in Leesburg. I take care of wide age groups from 21 to all the way to 100 plus. And I'm affiliated with Innova Loudon Hospital. So I practice traditional internal medicine. I go where patient goes. I have my own office setting. Then I see patients, my own patients in the hospital if they get admitted, and follow them sometimes at the rehab in Leesburg too. So that's my what I do right now. So without ado, let's begin the. I got the PowerPoint presentation, and we can talk about the heart health. Okay.
Sounds good. And Suman, I'm going to allow you to share your screen if you have the presentation ready to share.
Sure.
So. Ellen, if you could mute yourself, otherwise I can mute you. Just 1 second, let me mute you, Ellen.
Eric, what's that noise?
We've got a, someone's not on mute, so I'm trying to.
All right. Everyone, if you could mute your screens, that would be great. Everyone but the doctor, of course.
And Suman, I do have the presentation here if helpful.
Yeah, can you, I don't know how to do this. Can you just add that one in?
Yeah, sure. It would be, so back here in Zoom, if you do want to try it, just click the big green share screen button.
Yes, I see that here. And there's some issue with the security.
Suman, I can just share it here if helpful to you.
Yeah, can you please?
You'll just need to. It's okay. You'll just need to go ahead and tell me when to progress the slide. So just say next.
Okay. No problem.
All right.
Sorry about that.
No, it's all good. No problem.
All right. Again, the topic today, I chose Pump That Heart. I actually run a group called Pump That Heart, which is, to have a healthy heart. I have a WhatsApp group. Usually, right now, I'm doing with my friends and family, but this is something I want to encourage everybody to, whatever small community you have, to have a group where you want to, encourage each other to have some kind of exercise on a regular basis. So again, I'm board certified in internal medicine. I'm affiliated with Loudoun Hospital. These were, next slide, please.
Okay.
So what I've done with the presentation is I've taken some of the core preventive measures that has been discussed in ACC, which is American College of Cardiology, and that's what I'm going to discuss today. Next slide, please. As we can see, this figure, this picture shows that where the heart and circulatory disorders, these are one of the leading cause of death in US right now. Compared to the war, how much money we spend on the war, compared to a lot of heart issues that can be dealt with are preventable. And I think if we work together, if we work on it, I believe that, there are some of the deaths can be preventable, and also giving education to a lot of people would help to identify and rectify the problem. So again, the importance of the slide is to just show where all the deaths that's happening. So the number one leading causes of heart disease. So next slide, please. So there are some of the risk enhancing factors. So if a patient has these factors, they are much more prone for the heart disease. Like it's described here, the family history of premature ASCVD is nothing but atherosclerosis cardiovascular disease. It's basically the cardiovascular disease, especially in males less than 55 and females less than 65. If somebody has a family history of the patients with the males being less than 55 and females 65 have high propensity to have heart disease. So to identify these patients early on and get them treated, get them checked would be a top priority to prevent heart disease. Then the next one comes to the hypercholesterolemia, which is having LDL and non-HDL. So LDL is a bad cholesterol that we call it, usually the cholesterol that sticks to the big vessels. And also the non-HDL cholesterol. HDL is a good cholesterol which try to get rid of the bad cholesterol and help us. So whenever you have high HDL, that means that you are doing your arteries are in good shape. So we need to check this yearly status of LDL. Then there is something called metabolic syndrome, which has multiple components to it. I think most of the American population fits that criteria, which has got increased waist circumference, elevated triglycerides. It's a large cholesterol molecule. Then elevated blood pressure, elevated glucose, and low HDL. So any of the three components in this can make into metabolic syndrome. And again, the identifying factors, somebody with these factors, and get them to the medical office and getting them evaluated for heart disease. Then any patient with chronic kidney disease needs to be checked out. Also with chronic inflammatory conditions such as psoriasis, rheumatoid arthritis, lupus, etc. Next slide, please. Also, there are some other risk enhancing factors here. People with premature menopause, high risk ethnicity, South Asian ancestry is one of the top contenders here who have heart disease. Then a lot of lipids biomarkers, especially the high sensitive zero protein, elevated lipoprotein and apoprotein. I mean, you don't have to know all this, but just to have back in mind that there are certain things that make you prone to have heart disease, especially obesity, high cholesterol, premature heart disease in parents, and all that. Next slide, please. So what I'm going to discuss today is basically how to have this heart health prevention, how we need to take care of ourselves and help achieve better heart health. So there are different factors that can affect the cardiovascular risk. The lifestyle factors that I've listed some of them here, but there might be more than what I've listed here. The fast foods, or any kind of any kind of nutrition which doesn't have a proper nutritional value can cause a lot of cardiovascular morbidity. Obviously, sedentary lifestyle and the screen time. We all know what's going on right now. We are under this tremendous stress and pandemic, and we all are hooked on the screens. And this is a risk factor for cardiovascular disease. Then the smoking, alcohol, obesity, and being overweight, increased waist circumference, as we discussed earlier, uncontrolled diabetes mellitus, elevated cholesterol, elevated blood pressure. And we're going to go one by one in the next slides. Next one, please. Derek?
You should be able to see it. It's the nutrition and diet.
Yeah.
Coming through. It's a picture of a really amazing hamburger.
Yes. So, yeah, nutrition and diet. When you look at the picture, it says it all. We love this kind of food, but actually, it's not. It's got a lot of trans fats, saturated fats, which straight directly goes to your arteries. So, next slide, please. So, American College of Cardiology actually recommends certain things to be part of your diet, daily living. So the number one, they emphasize more on vegetables, fruits, legumes, nuts, whole grains, fish, anything with cold water fish helps to decrease cardiovascular disease. Then coming to any kind of replacement of saturated fat with more of monosaturated, like olive oil, avocado oil, would be help and beneficial of this risk. The third one, again, cutting down the amounts of cholesterol and the sodium is also shown to be beneficial in this risk. Next slide, please. So as part of the healthy diet, we definitely have to look into how we go about it, especially with processed meats, refined carbohydrates, sweetened beverages. I do, in my office, have a list of things that we absolutely avoid. We try to tell the patients to avoid juices as much as possible, colas, any kind of colas, and any kind of fries, anything which is in the plastic cover, which tends to have a lot of processed stuff, so which can increase the risk for the cardiovascular disease. And the last but not the least, as we all know, trans fats are not good for health, so avoiding it would be helpful. Next slide, please. So looking at this slide, Santorini, this part of the globe has some of the best diets. It's called Mediterranean diet, which has actually shown patients to, when they took this diet, they have actually shown there was tremendous benefits. So there was a study done around 12 years ago with the Mediterranean diet versus regular diet on the post coronary bypass patients. After a couple of years, the study was halted, and the results were amazing. That the heart disease dropped by almost half. So again, you know, if you Google it, you can see it's Mediterranean diet. I think you don't have to have heart disease to start this. Anybody can reap the benefits. I think this is one of the best things, best advice, you know, as a physician I can give is, you know, everybody look into this kind of diet where, you know, you have good fats, good protein, less red meat, a lot of vegetables would help with heart health. Next slide, please. Okay, coming back to alcohol, I know it's, I like this one because, you know, when I ask patients how much alcohol do you drink, doc, I drink only 1 glass a day. So, you know, that does make kind of joke, but the actual point is alcohol has shown, it's a very controversial study because right now they say 2 glasses for men, 1 glass for women is okay, but actually the recent data shows mixed. So what they're saying is you can have 1 glass per day. As soon as you take a second glass, your risk of having cancer goes up. So there is some beneficial effect if you take 1 glass of wine or alcohol, but there, as you know, we usually don't stop at 1. So the idea is to try to minimize as much as possible social and, you know, not every day. So we all know that with the pandemic, the alcohol consumption has gone way up. So yeah, next slide, please. All right, coming to exercise and physical activity, we all tend to, you know, say we're going to exercise. And again, the problem is, you know, it is tough. We don't have motivation all the time. And this can, you know, this is a classic regimen, how we tend to do things. We try to exercise, but somehow we are drawn to the TV or something else, and we miss the part. And obviously the cell phone is huge these days. Next slide, please. So regards to recommendations on exercise and physical activity, they recommend adults should routinely consult for healthcare visits and optimize physically active lifestyle. Adults should engage in at least 150 minutes per week of accumulated moderate intensity or 75 of aggressive aerobic physical activity. Actually, the new data is suggesting even more. They're actually encouraging to do 300 minutes of moderate intensity. Next slide, please. It's kind of a similar thing. What they're trying to say is, you know, to who doesn't need that many minutes, as long as they're able to move, which would help with the cardiovascular disease. And number 4, decreasing sedentary behavior also will help in that in the cardiovascular disease. Next slide, please. So these are some of the terms we use. I know it's a medical jargon, but you know, I'm going to just make it simplify it. MBTs means metabolic equivalence. So amount of energy expenditure there, how much you're doing. So when you look at the sedentary behavior, sitting, reclining, lying, watching TV, you're not doing any of the metabolic activities here. So it's very low of metabolic equivalence. And the light intensity is walking slowly, cooking, light housework, which is better than sedentary behavior. And the third one is moderate, which reaps the maximum benefit. So if you're able to do the moderate activity on a regular basis, this has shown to increase the longevity and reap the maximum benefits. So if you're able to do the moderate on a daily basis, that would help. Then the vigorous, if you're able to do from time to time.
Everybody, just 1 second. Let's get Suman back here. Suman, please unmute.
Okay.
Sorry, there was I'm just trying to mute. Ellen's having some audio difficulties, so sometimes it turns on and off, but please continue.
Yes. So what I was saying was the moderate intensity is the one which you have to aim for on a regular basis, and avoid certain behavior. Even the light work should be good. Walking slowly, I mean, getting out of the chair, every couple of hours has shown to have better heart health. So next slide, please. This again, a similar kind of activity. So one third of our lifetime we spend sleeping, 1/3 possibly working, and the rest of 1/3 is the one which I think needs to be managed appropriately, not sedentary. So I think that's what determines, how your heart gonna be. So use your time wisely and try to move as much as possible. Next one, please. So this is again, it's what they say is if you're spending more than 2 hours on screen, which has increased likelihood of disease, which by 125%. Yeah, this is the new reality we are facing right now. I think trying to get rid of apps which are not useful, trying to stay off social media as much, So again, the point comes to is the time management and try to cut down the screen time and try to move around as so next one, please. So adults with overweight and obesity, I just had to put that one there. So yeah, we all don't like our, when we go on the scale and, see what's going on. And so next one, please. So the recommendations for people with overweight and obesity, so weight loss is recommended, which will improve the overall morbidity and mortality. Even 5 to 10%, actually studies have shown, even 5% of body weight, if you lose, there are a lot of chemical changes that happens, which will help to fight off some of the cholesterol issues and the plaques on the arteries and all that. So I think it needs to be encouraged. So next one is the counseling with basically talking to the patients and trying to get what other things need to be taken care of and help them lose weight. Third one, BMI is something that we do, height versus weight, which kind of puts you at a different scale on overweight or obesity and all that, because the studies have determined that if you are on certain BMI, your risk of heart disease goes way up. So some of the other determinant factors are waist circumference too, as you can see that we have seen this before in metabolic syndrome. So the waist circumference also is very, very important cardiometabolic risk factor. So next one, please. So adults with type 2 diabetes. So what's going on latest right now nowadays with all the emojis and all that. So I just had to put that one. Next one, please. So adults with type 2 diabetes, again, the type 2 diabetes it's a lifestyle disease. So what we need to do when somebody has type 2 diabetes is to have maintain healthy lifestyle and improve their glycemic control and achieve good weight loss, and stick to the plan where they can lose weight and improve their risk for cardiovascular disease. So nutrition plan is important. Then coming exercise, the second one is exercise. So they have to work on their activities on a regular basis, which will again improve the glycemic control, which will improve the heart health. Next one, please. And the other one include, usually if you are a pre-diabetic or diabetic, nowadays we tend to start with metformin, which is one of the top choices for type 2 diabetes mellitus, which definitely works in multiple ways to improve glycemic control, and also it's shown that it reduces atherosclerotic heart disease. And the fourth one, there are certain medications which can help if it's uncontrolled, if the blood sugars are not controlled. The metformin, along with what we call SGL2 and GLP-1, which helps significant improvement in glycemic control, which also reduces cardiovascular disease. Next one, please. So this is a simple slide which shows that what can be done. The HbA1c is nothing but, and somebody has a blood sugars, it's a 3-month blood sugars. So whenever somebody gets a blood work done, this is something routinely done for all the patients for their physical, and mostly for the wellness visits. And what it shows is that the important things that needs to be taken care by diabetic patients are the dietary management, exercise, metformin, if they are able to take it, and aggressive treatment for other risk factors if they have. And this needs to be, I know this is kind of a busy slide, but this is something that we encourage patients to achieve heart health by aggressively working on it. Next slide, please. So adults with high blood cholesterol, this was the publication a long time ago. It's almost 30 years ago. So it was like a cholesterol myth back in the day, but things have come along a long way. So let's look into the recommendations. Next one. So atherosclerosis timeline. When you mean atherosclerosis, there's a fat deposits that's building up. So when you look at the normal part of the vessel, this is a vessel. When you look at the first decade, there's a small layer that's forming, and as you go into third decade, that's when it's just exponentially increasing in size. And once it breaks off, where the complicated lesion or rupture happens, that's when it causes heart attack, stroke. So we are trying to catch, especially in earlier, when there is an intermediate atheroma stage, even the fast plaque, and start treating them accordingly and help them to achieve heart health. Next one, please. So what we need to do with the high blood cholesterol. The recommendations are, so there is a score called ASCVD. Anybody can look into that if you have a basic blood work. What it recommends is, where is your risk level, where the patient risk level is, and this determines the mild risk, intermediate risk, severe risk. So whenever the percentage just means, when you look at the data, when you look at the score, you have to put certain determinants in there, like blood pressure and LDL and other sex, age, everything else, that will calculate and gives you the risk score. So whenever the risk score is between more than 7.5, so there is a data that suggests that these patients would benefit from moderate intensity statin, which is a cholesterol medication. So again, the cholesterol medications, fairly recently, last 3 decades, four decades, I would say, has changed the whole the cardiovascular treatment. Right now, we don't have to have angiogram right away. If they have mild heart attack, if they have not major medical problems and they have mild issues with the heart, the current treatment is to just do non-interventional medical management, which trumps, and actually the level of evidence is pretty high. So the cholesterol medications have come a long, long way, and it's changing the management of heart disease. So these scales just show where they fit and what kind of medications they need. Next slide, please. So if they have diabetes and if they are between 40 and 75, they need to be on statin. This is a very high recommendation. Any patient who is with this age group should be on the statin treatment, which definitely helps the patients to achieve heart health. Then patients between 120 and 75, when the LDL, the bad cholesterol goes more than 190, that's again discussion with the physician and patient regards starting off the statin medication. Next one, please. Number 5, again, people with diabetes with multiple risk factors, they should get the statin therapy to make sure that they lose the 50% of LDL levels. Recently, we have seen that there's newer medications that have come, which have, it's once in 6 months to once a year medications, which can drop cholesterol just by 1 injection, more than 50%. So people who are not tolerant to these medications, there are new medications available. Right now, it's very expensive, but I think it's coming to the market very soon. Next one, please. And in the intermediate, if there are doubts about the risk stratification, what they say is to do a CT scan of the coronary arteries. So we call it coronary artery calcium score. That also determines whether they need any kind of statins or not. So if the score is 0, then you withhold. You can hold the statin and repeat the test in 5 to 10 years. If the score is between 1 to 99, that's a reasonable. You can initiate the statin therapy. Then if the calcium, if the coronary artery calcium score is 100 or higher, it's very high. That means they need it right away. So next one, please. Again, this also says a similar kind of picture where they need the statin therapy. Next one, please. This is a busy slide. It's a slide that shows what we discussed earlier about the cholesterol. So I just attached there, but we just discussed this. So we can go to the next slide, please. So again, with the blood pressure, I think that's one of the more underreported problem. Even patients know that they have an issue, but most of them kind of don't take their medication properly or don't seek help. I think this is one of the most important ones that you can try to prevent, and not much needed. I mean, there's a lot of non-pharmaceutical interventions that you can do to improve the blood pressure. Next one, please. So in adults, this is a primary recommendation. What they say is, especially elevated blood pressure, including those requiring antihypertensive, the non-pharmacological interventions are recommended to reduce BP. So there are different kinds of things that if you can see: the weight loss, the heart-healthy diet pattern, sodium reduction, dietary potassium supplementation, increased physical activity, limiting alcohol. Each one has different amount of points that we're going to discuss in the next couple of slides. But you don't have to do everything. You can start with some, limiting alcohol, which tends to, improve blood pressure, and heart healthy diet, cutting down the processed meat, cutting down the meat itself, cuts down the sodium. So there are a lot of things that you can do, will help you to achieve that. Next one, please. And people who have this risk factor, like we discussed earlier, you want to keep them between 130 and 80. But usually, this is recommendation between, I would say, healthier, more minor issues, more of high blood pressure only patients. This holds true. But if the patient has a lot of medical problems and they're elderly, I would say if they're 70s and 80s, which we do see all the time, the data is not very good, like how to maintain their blood pressure, whether to have a strict 130 by 80, because what happens is as we age, our arteries get stiffened, and patient A might need a little bit higher blood pressure versus patient B. So if patient has a blood pressure supposedly around 140 by 90, and this is an elderly patient, and they are functioning good, and they don't have any symptoms, any dizziness, I think keeping at that number would be ideal, rather than you want to bring that number to 120 by 30 or something like that, 120 by 80, or something like that. So it's, again, I think the case-by-case basis once patients turn 70 and above. So I would, but until, again, it's more of a case-by-case, because we have seen titrating the blood pressure so strictly actually causes more falls, more weakness, more issues. And we do see this quite often, and we do have admissions coming to the hospitals because of this. So again, it's a more of a case-by-case, individual cases. Next one, please. So again, it says the same thing for chronic kidney disease, and who have the high risk for cardiovascular disease. You want to have 130 by 80 recommendation for the blood pressure. I think this holds true, like I said, between 40 and 75, without any other major comorbidities. So, next one, please. Also, type 2 diabetes too, they advise to have a goal of 130 by 80, and when they hit 140 by 90, they want to initiate the blood pressure medication, especially with high-risk groups. Next one, please. It says a similar thing of keeping it around 130 by 80. Next one, please. So this is kind of a draw, whatever we just discussed, says how we need to look into this. So the guidelines have changed. Before it was 130 by 80. Before it was 130 by 80. Recently, the guidelines have changed to 120 by 80. So I'm not sure why they did that, but the thing is, I think they want to just include a lot more people to have a talk and discussion with their doctor, try to prevent the future deadly disease. So I think which is good that once you start being in the pool, then you can work on how to take care of yourself and talk to your doctor and get healthier, take care of their heart. Next one, please. So these are the things that can help. So if you look at each one, weight loss, if you lose 1 kilogram, you can expect to lose 1 millimeter of mercury. So the maximum benefit would be that when you have hypertension, you can lose almost 5 points down, which is huge. I mean, if you look at other things too, there's something called DASH diet, which is specifically for hypertension disease. So these are very highly rich in fruits, vegetables, whole grains, low-fat dairy, and that actually reduces by 11%. So I would go ahead and add, the meats. If you can cut down the amount of meat consumption, I think that makes a big difference. So the first two itself, you can lose almost like 15 points if you're able to do it strictly. Then again, the sodium is very important. They all go kind of hand in hand. Sometimes taking dietary potassium, which, if you look at some of the dry fruits and all that, they have a lot of potassium, coconut. If you're healthy enough to take it, I think that's good. Because sometimes if you have kidney issues, if patients have the kidney problems, then we don't advise them to take too much potassium. Next one, please. And physical activity, if you look at that, if you do a 90 to 150 aerobic activity, then you can lose from 5 to 8 points. Then dynamic resistance, where you do exercises on a regular basis, you can lose 4 points. And so if you're lifting weight and all, you can lose 5 points there. Again, the alcohol consumption, I think alcohol raises blood pressure. I think there's no question, no doubt about that. I don't buy this men less than 2 and men less than 1. I think any amount of alcohol can cause problems.
Dr. Manchireddy, we're running out of time. Are there some?
I think we are almost done. We are almost done.
Okay.
Yeah. Give me 2 minutes. I think we should be done. So tobacco use, next one, please. Yeah, the tobacco use is one of the things that we want to, emphasize because it can cause the problem with the cardiovascular disease. Next one, please. Yeah, again, the similar thing of abstinence is required with the tobacco to reduce their risk. Next one, please. The stress management, we need to take care of the stress. We have seen the pandemic. It's less now. Next one, please. So I think of all the things, the time management is very important. How you want to dedicate your time to various things is very, very important. All this kind of helps. Having a me time also helps. Having time for self. 15-20 minutes will help. Next one, please. This is aspirin use. There are a lot of questions about aspirin use in seniors right now. So what they say is if they don't have, then they don't want to give aspirin for primary prevention in patients above 70 because it causes more bleeding than it helps. But in between 40 and 75, if they have diabetes and certain things, then they need to do aspirin. Next one, please. Next one, please. Yeah, I think quickly we can go one by one. So take home messages. The first is, healthy lifestyle, promote a healthy heart. Next one.
Actually, Dr. Manchireddy, we actually do have to end because there's some other things we need to do, and we only have 15 minutes left.
All right, no problem.
I apologize.
Yeah,
but
okay.
Please reach out. One of the things I really loved about your presentation today is you talked about ways to take care of yourself that are not medication related. And that's really important. So it is about what we do every day, and not, you know, waiting until it's too late to try to fix it. So
Right.
I think that's the key right here. So exercise, eat right, don't drink too much alcohol. Sorry, I can't give it up completely, but but really take care of your heart, because it is, heart health and brain health go hand in hand.